Hello, my name is Katie. I'm one of the nurse practitioners who works for the Orthopedic Surgical Group at Children's National Health System. I'm here to talk with you today about how to take care of your dressing and your incision after your posterior spinal fusion. If you have any questions or concerns that are not answered, you're welcome to call us and we'll be happy to answer your questions. So we are going to take off your dressing now, and I'm going to talk with you and your mom and dad about how to take care of your incision when you get home and when you need to clean it and things to look for that would be concerning, okay? This isn't going to hurt you at all. It's no different than taking off a big Band-Aid. You're going to leave the dressing that I put on today on until postoperative day 7. And on postoperative day 7, you can take your dressing off and get into the shower at that point. There's going to be either Steri-Strips or Dermabond underneath your dressing. The Steri-Strips and Dermabond you do not remove. Leave those on. They're slowly going to peel off over the next 10 to 14 days as the skin beneath them heals. At home, you don't need to use any special soaps to clean her incision. Okay, so as I was saying, on postoperative day 7, she can take her dressing off, and that's when she's going to get into the shower. She's going to wash the incision gently with soap and water. The Dermabond or Steri-Strips need to be washed with soap and water gently every day once postoperative day 7 has come. And then she's going to get out of the shower and pat it dry. She doesn't need to put a dressing back onto it at that point. It needs to be clean, dry, and open to air. Now, things to be concerned about. Signs and symptoms of infection. Call immediately if you think your wound is infected. Signs of infection include unusual redness or swelling around the incision, red streaks going away from the incision, increasing pain and tenderness not relieved by pain medication, pus drainage that looks white or cloudy, edges of the incision separating, or a fever greater than 101.5 degrees Fahrenheit. Key points to remember when taking care of your dressing and incision after your surgery. Remove your dressing on postoperative day 7. Do not remove the Steri-Strips or Dermabond that you will find underneath your dressing. Allow these to fall off on their own. It will take 10 to 14 days for your Steri-Strips or Dermabond to fall off after surgery. You may trim the edges as they peel away from the skin. You may take your shower when you remove your dressing on postoperative day 7. When you take your shower, remove your dressing first. Then get into the shower and wash the incision with soap and water. Pat it dry. Leave the incision clean, dry, and open to air. You do not need to put a new dressing onto your incision once you have washed it with soap and water. You may wear a separate tank top or t-shirt underneath another t-shirt to prevent the Steri-Strips or Dermabond from snagging on your clothing. You do not need to put any ointments, lotions, creams onto your incision once you have removed your dressing. Once you have followed up with your surgeon and they have cleared you to start using lotion on your scar, you may use sunscreen to help protect it from the sun. This is the best thing to help your scar tissue to fade back to its natural skin tone. Thank you for watching this video on how to take care of your incision and dressing after your posterior spinal fusion. If you have any questions or concerns, please refer to your guidebook or feel free to give us a call at Children's National and we'll be happy to address your questions and concerns.